Do you have a credible source to get health-related information in Zimbabwe? If you don't, listen to Health Matters every Monday from 2030 to 2100 hours with Zororai Nkomo.
Health Matters. Your body, your choice, your life. Z.
I'm feeling lucky. Hi, this is Shingai Shoniwa, and you are listening to ZFM Stereo, where the biggest stars play back to back. My station, your station.
Z. Local music on your station of choice. We Rock Radio. Proudly Zimbabwean.
Station does it well.
Z. Health Matters. Your body, your choice, your life.
Welcome to Health Matters, your weekly program on ZFM Stereo, where we discuss all health-related issues to raise awareness towards creating a well-informed and a healthy Zimbabwean community or society. Our discussion today is on sexual and gender-based violence in Zimbabwe. I'm your host, Zororai Nkomo. Before we go into the main discussion, let me share with you some of the statistics which we have as Zimbabwe or as a country. Latest reports and data show that 12% of women reported sexual violence, while 5% experienced it in the last 12 months. According to Data Brief on Understanding Violence Against Children in Zimbabwe, this is information, or this is a survey conducted by the UNICEF and the government of Zimbabwe, that is the Ministry of Health and Child Care. 1 in 5 girls aged 18 to 24 experienced unwanted sexual touching before the age of 18. A total of 15% of girls had experienced attempted sex, and 9% experienced physical forced sex. It is very important to note that all forms of violence against children and women place a significant burden on their health and well-being. In this discussion today, I am joined by Florida Mapeto from the Adult Rep Clinic. She's the communications officer there. And Danai Chirau, legal and communications officer with the Zimbabwe Women Lawyers Association. Ladies, welcome to Health Matters.
Thank you for having us.
Let me start with you, Florida. We are talking about Adult Rep Clinic. What Adult Rep Clinic is all about?
Okay. So Adult Rape Clinic, or now known as ARC, is an organization that specializes in the management of sexual gender-based violence. So what it means is that if anyone has to walk into our clinic at any given time, they can expect to receive a comprehensive sexual gender-based or post-rape service.
Then where are you stationed right now?
Okay, we are located in the corridor of Ward C9 Parirenyatwa Hospital, and we now also recently opened offices in Kadoma, Mashingo, and Gokwe.
Okay. Why in Parirenyatwa?
Okay, so we were strategically placed first and foremost because for us to be able to conduct what we call the forensic medical examination, which encompasses filling in of the medical affidavit for the court process, we have to be stationed at a government institution or government hospital. Secondly, this has actually helped us to manage our survivors in terms of stigma chaiyo. Munhu anongopindawo muhospital ngari kuuya kuzoona hama yake iri kurwara, or they could actually just be sick with anything else. Saka chero ukadhumana nemunhu uchibva kuARC, no one will really ever know that you were at a rape clinic. So we strategically had to be in a position or placed in a space that is comfortable and safe for survivors from stigma.
Okay. Then what is we are talking about sexual and gender-based violence in Zimbabwe. What is the general trend?
Okay, so I think there was a time, I don't know if you remember, where a report came out and it was released that at least 22 women are raped in Zimbabwe on a daily. I think it was 2017 or 2018, I don't remember. But I won't speak on the national statistics, but I'll speak specifically from the trends that we have noticed from ARC. And since inception in 2009, our numbers are increasing. And last year, we recorded the highest number of survivors that we had seen, both male and female. I think we had about 1,005 survivors at the close of 31 December 2019. And this year alone, I'm not really certain on what number we are on, but we've fairly surpassed the number of survivors that we had seen by this time last year. So this is very concerning if you look at it, and also because a lot of the rapes that even in Zimbabwe are not reported. A lot of them are handled at family level. A lot of them anongonze we exercise a lot of harmful cultural practices that sort of perpetuate or allow certain rapes to go unreported.
Okay, yeah, then on the issue of trends, or what is the age like when since you are working with the victims? What is the trend in as far as the age of survivors?
Okay. So the highest number of survivors that we cater to, even since inception, there was a time when we started what we call the #72 campaign. We realized that over 72% of the survivors that we had seen were adolescents and young people. So you're talking about ages that are ranging between the age of 10 and around 15-16 years. And then from there you from your 17 to 24 young people, what we call youth, they're also a fairly large number. And then as we get to older ages, it becomes less.
Okay, then let me come to Danai. From a legal perspective, Danai, what is the trend of sexual and gender-based violence which you have recorded in this country?
Okay, I think that when we're looking at the trends of reporting, a lot of reports are being made through the Ministry of Health, in that kana munare panoenda ku chipatara onorapwa, you can get your morning after pill, you can get your PEP, etc. So a majority of the reports are actually coming through the Ministry of Health, but maybe a third of those reports make their way to the police station, meaning that there are less and less people wanting trust in the formal justice system. And what happens is that if you go and report your case, especially more COVID, you will realize that when I struggling travel restrictions, there was also skeletal stuff here in kuma courts and sometimes kuma police station, meaning that even nyaya dzakudhara dzanga dziri pending, dzanga dziri part of the backlog, dzatowedzerwa nebacklog yakaitika due to the COVID-19 pandemic, which means kana iwe waenda kucourt, you're going to expect to have so many postponements before your matter actually goes to trial. And when you notice the statistics, Emma, withdrawals, majority of the withdrawals are happening at police stations because of undue influence or societal influences. Usually, because a lot of perpetrators vanhu vekuziva, and then also vanasekuru vanani, and within that family zvinogarwa dare handiti sometimes panenge paine kuripana kunenge kuchiitika. And also I was just thinking about some of the information we're receiving. So we've got my community paralegals, especially in the remote areas, because of the way communication gonna kunetsa tikada kuti let's put it online or what, tinenge tine focal presence in the community, and they're reporting that madzimambo vari kutora futi vachitonga nyaya dzerape, yet they're actually not supposed to be trying nyaya dzerape. So madzimambo, they are trying nyaya dzerape, and how they're resolving it is kuripiswa. So that actual survivor pachake haasi kuonekwa because iye marights ake haasi kunyatsa kuiswa pamberi. Panenge paine preservation of culture, preservation of expectations. Kumachechi ndiwe mainingi warepwa nemufundisi, who are you going to tell? we also have noticed kuti muZimbabwe pane a lot of rapes dziri kubuda mumachechi panyaya dzemaprofita because of the level of trust inenge yaitwa placed on that individual. So marapes akadaro, what happens is vanhu vanongogarisana pasi kumachechi and it's dealt with within the confines of the church, whereas we would be encouraging people to report because the criminal justice system is there for deterrence. It's also there for rehabilitation. Deterrence uchireva kuti inokwanisa kuti munhu akaziva kuti iwe ukaita izvi uchatopinda muchitokisi uchigara 5 years. People might feel like ini handinoda kubata izvi because zvinogona kundisungisa. But if you see people walking scot free, knowing kuti iwewe kana uri accused of rape and nyaya yako inogona kugara 2 years isati yatombopera, unokwanisa kutiza. We're seeing bail courts kuti panenda unoapplywa bail, perpetrator anenge achitogara achirojo in the same house as the complainant. Court inongomuti go and stay at that house wakamirira kuya kutrial, which means every single day of your life uri kutsarisana nemunhu iyeye anenge akakumhirizhonga. So that all is coming together to decrease confidence or to nyatso kumeka vanhu kuti vafile kuti zvinhu hazvishande. You would be better off getting health services before you're getting ma services ayanobva kumapurisa and all. And then the victim friendly unit, which is the specialized department inofana kunge ichidila negender based violence, is severely underfunded. Unlike traffic havana motorbike, so they really can't be traveling, especially in
rural areas.
Onzi wewe ndiri ku ward 9 ndinokava ward 9 ward 21 ward this ward that, they could be 20 Ks in between those wards and 20 Ks between the main police post necamp inenge yakaiswa anonzi machiko like tuma police post tunenge tusiri the major ones ndo anenge akazara kumarural areas. Nyaya yako painozotransferwa, and in addition nyaya dzese dzinotanga dzaenda ku-PGHQ dzozodzoserwa kuma-police station. That is also taking more time before a matter can be finalized. And then kuti nyaya inzi yapinda mudare, docket inofanira kunge rakakwana. Kana docket risina kukwana, then the matter cannot go anywhere. Even as a defense counsel, for example, ndenge ndatoona macracks kuti apa hapana exhibit, hapana semen sample, ma-rape kits muZimbabwe, forensic evidence haitariswe, hakuna DNA testing inoitika zviri very easy. Panenge kunewo vamwe vanhu vanenge vachinda psychiatric evaluation. It can take up to a year, 2 years, 3 years munhu asati aitwa psychiatric evaluation kuti zvinzi nyaya enda mberi. Tozotarisa vanhu people with disability vanenge vachidawo a specialized person. Ukasvika ku-police station and you can't speak, unenge uchida munhu anotaura sign language kuti azowanikwa munhu yeye kuti atranslate nyaya yako. That's a whole other hurdle. Maybe munhu ane mental challenge. Section 64 of the criminal code inototaura kuti munhu ane mental incapacity chero akabvuma nemuromo haana capacity to consent to sex, so it should be reported. Munhu akadaro anenge achida a psychiatrist or a psychologist to communicate naye, but our courts don't have that because the resources that are supposed to be allocated to that haako. So now nyaya dzinongorova apa zvinonzi mhosva hairovi, but in Zimbabwe that might be different.
I just want to find out, you were talking about withdrawals. What is the trend like? Is it during the pre-trial, during the trial stage?
Majority of the withdrawals are happening in my police station, and then when we withdraw from police station, nyaya dzinozocascade to the courts. Iwewe se munhu anenge amangana nyaya yako, you can actually withdraw your own case ikoko. Sometimes people are withdrawing because of sheer frustration. Wanzwa nekuenda muchuchisi wako havusukumuziva and all those other fears. Wasangana defense counsel wavunduka because wafungotaona lawyer, not knowing that your lawyer is actually the prosecutor. So that lack of information is making a lot of people fearful, and it's making a lot of withdrawals happen. And then after my withdrawals azopera, we're not even looking at the statistics of my acquittals. Zvichireva kuti vanhu vari kutongerwa nyaya yerepa vachionekwa vasina mhosva simply because of the level of evidence inenge yaunzwa nestate. Kana mupurisa asina kuenda kunokollecta semen sample, iwe warohwa nechidhina, mupurisa haana kunonga chidhina ichocho as evidence, then how can I come to court and say ndakarohwa nechidhina chisiri mu-exhibit? You know, all those things are ignored. So my withdrawals are happening at every level prior to the trial itself.
Florida, let's say a person is raped, or what he or she can do.
Okay, so our first point of call is don't keep quiet. If you have experienced any form of sexual violence, silence will not protect you. Silence will not help you in any way. Tell someone that you trust. because I think this culture of silence that we have kuti nyaya dzineche zvekuita nepabonde or sexually related issues, we regard them as taboo, always sort of creates a barrier in reporting cases of sexual violence. So talk about it. It's not your fault. You did not violate yourself. So talk about it, number one. And within 72 hours, rush to your nearest health facility. It could be a clinic or a hospital. And there you will receive medications for the treatment of HIV, STIs, and pregnancy. Because we also, perpetrators, munatori reckless in their behavior by virtue of just being a perpetrator. So we assume that they could actually be positive and they're trying to spread an infection, or they could have a sexually transmitted infection. So we assume that, and we take, or we do what is called a voluntary HIV and testing service. Then you get tested and we see where you stand before we give you treatment. We give Inonzi PEP. I don't know if you've heard of it.
Yeah,
post-exposure.
Yes. Yeah, we heard people saying PEP, PrEP. Can you just elaborate on that?
Okay, so PEP is post-exposure prophylaxis. That is what you get after you have been infected, or if you have an accidental sexual encounter without protection. Then pre-exposure prophylaxis is given before for high-risk people. If you know probably that you are in a relationship but you don't trust your partner, so you take it before, so it's pre. But we do post-exposure because we are saying that you were violated. So, and no one really moves around assuming that they are going to be violated. So we specialize in post-exposure prophylaxis. And then we also give STI prophylaxis as well to prevent my STIs. And for women or female survivors, we offer what is called the emergency contraceptive pill to prevent pregnancy. That can be given up to 5 days, but we always encourage survivors to present within 72 hours because it's most effective when it's taken on time, and the earlier you take it, the more effective it is. So after you do that, we also encourage survivors, because don't wash your clothes, don't bath, come as you are, so that whatever evidence that may be collected when we do our forensic medical examination won't have been tampered with. Because kanoka scratch kwa maybe ukageza, you're covering those bruises, or if there was any other evidence like discharge or semen that would have been left, it would have disappeared if you bath. So we always encourage, don't bath. We are uri seja uri, and present to your hospital or your clinic.
Okay, then legally speaking, let's say a person is raped, then because we understand why I'm asking this is the fact that there are rumors that a victim of rape must get a police report first. We had some people saying if you are raped, you are supposed to get a police report, and also all those things. Say, because someone might be a victim, what he or she can do.
Okay. Kudara zvaimbonzi kana iwewe uri wabatwa chibaro kana kuti wambunyikidzwa kuenda pabonde, tanga waenda ku police station. First go to the police station, but this has since changed. We've got a multi-sectoral protocol inotaura about referral pathway yekuti munhu kana arepwa anotanga kupi. And now we prioritize health because health ine ma-timelines. Pakuti you've got 72 hours to try and ensure that there is no spread of STIs, no spread of HIV, and kuti munhu abatire pamuviri. So the first place that you go to is a hospital or a clinic, a government hospital. And when you get to a government hospital, awufane kuvunzwa police report. You're supposed to just get that treatment first and then also enda kumapurisa. A lot of times people try and go to the police first, but we encourage that you go to the hospital first within the 72 hours. You can always report everything else, because within those 72 hours unenge watoitirwa that forensic medical
examination.
Forensic medical examination handiti. So vanenge vatotora zvese kuti wakabruzika wakaita sei. But even if you haven't gone within 72 hours, we still encourage that you seek these medical services first and then you go to the police station. When you get to the police station, ask to go kunonzi ku victim friendly unit, because paunosvika ku charge office kunotorwa macharge ese, but there is a specialized department zvakangofanana nekuda kuenda ku traffic, zvakangofanana nekuda kuenda ku anti corruption. Taura kuti ini ndida kuenda ku victim friendly unit kana kuti ku VFU, ndo kune mapurisa ari specialized to deal with nyaya dzakadai. Wasvika ikoko kunofanira kutorwa yatinoti witness statement yako iwewe ndiwo unofana kurondedzera kuti chii chakaitika, and try and give as much detail as possible, because more often than not rape happens pakawanda, kana kuti pakati pevanhu vaviri, kana kuti pakati pako iwewe survivor nevanhu vese vakakurepa. It seldom happens pajekerere pekuti munhu asandokwanisa kutaura kuti pakazodai pakadai, kana kuti pane recording inodai. Taura iwewe nyaya yako, then mupurisa anenge achitora nyaya yako anokunyorera summary. You can even ask to write your own depending in the area, because we've seen a lot of hostility. Munhu akataura kuti inini ndida kuzvinyorera ndega statement yako yapera, usually they ask you kuti who was the first person awakatsanangurira nyaya iyi. The first person to be told iye anotorwawo statement yake, and then kana une mamwe mawitnesses, their statements are also taken. Wapedza kudaro, mupurisa anonzi investigating officer wako weku victim friendly unit iyeye anofana kuenda nedocket rizere rinenge rine information inodikanwa there, a list of expectations kuti docket inofana kunge rakadai. After docket razara rinoendeswa ku vetting, ku prosecution, ku court, lawyer rako raunopiwa nestate muchuchisi. So kana iwe warepwa, you don't necessarily need to have an external lawyer anokubatsira, because when it comes to the crimes anoitika muZimbabwe, the state inokuallocatira gweta rako rinonzi PP, public prosecutor kana kuti muchuchisi.
Whether ndine mari, whether ndine mari.
Exactly, and you're not supposed to pay a single cent kana waenda kuma courts ikoko. Akana wakutobhadhara wakutodhiza. Yato corruption iyoyo.
Yeah, because the public knows kuti if you want to be involved in litigation, you need to have a lawyer. So I think it's very important.
Exactly. Muchuchisi paunoenda ku vetting ndipo unozozwa kuti pane cause of action ere, pane nyaya ere inobatika, and then after that obva allocaterwa and prosecutor weku regional court. Kana iwe uchibva ku a small town kusina regional court, because let's say for example kana nyaya yako yatorwa ichiitwa ku Norton, kana yave ne rape mukati inenge saitirwa ku provincial court yakuitwa ku regional court, which means nyaya yako yaku Harare, anditi unenge wakutozo transferwa nyaya yako wakuti because of the different levels of courts na issues of jurisdiction anenge aripo, nyaya yako inobva yaita sei yaendeswa ku regional court. Ndokwa unowana prosecutor weku regional court anofana kumirira nyaya yako. Before you go to court, you must have a sit down with your prosecutor, because prosecutor kana achimirira nyaya yako anofana kunge achiiziva handiti. There are some things, when you read a docket it's a summary, when you read a statement it's a summary. Prosecutor ndiye anofana kuziya zvese, even your feelings. You know the difference between Zimbabwe and South Africa, even though the rates of rape are very high in both areas, is that in South Africa, in addition to everything, kune chinonzi victim impact statement. They actually do a psychiatric evaluation or a psychological evaluation of survivor, kuti chii chakazoitika maari chachinja kana kuti chakanganisika kana kuti all these other consequences of the rape, so that anobatsira kuburitsa nyaya yako. Kana munhu azobatwa ine mhosva, that can be used as aggravation, kuti in aggravating circumstances, in addition kuti munhu uyu arepwa handiti, now akutadza kurara because anoramba achita manightmares, akutogara achivhunduka akutya, hachasocialize. Some people start becoming detached, akutoramba relationship yaagara ari because akatorerwa something, akambunyikidzwa. Although we don't have those, but we can have a version of that by you talking to your prosecutor. Uchaanza kumuuliza kuti inini ndakutoshaya hope ninyaya yekuti chi ndakarepwa, kana kuti inini ndakabatwa mazamu na conductor ndiri mukombi. All those things you would need to outline kuna prosecutor wako, then your matter goes to court. And before your matter before that pane trial yaitika, panofana kunge paita bail hearing. A lot of people are worried kuti kana munhu abuda ne bail akutofunga kuti nyaya yapera, bail just means kuti musungwa we ari kupota achiatenda court achibva kumba instead of a custodial sentence, because mtemo unoti you are innocent until proven guilty. Saka as long as there is no conviction, we can't say kuti munhu ngaagara ari muchitokisi anotofamba achibva kumba.
Okay, thanks very much, Dana. In Florida, there is we understand that we were on a lockdown. The COVID-19 induced national lockdown. How it impacted on the issue of sexual and gender-based violence?
Okay, I think we noticed a peak and increase in the number of survivors that were contacting us via our virtual platforms. That is on our toll-free line, on our Facebook page, our Twitter page, our WhatsApp. And I think maybe because it was a triggering moment, I think isolation is unnatural for us as human beings, more so for survivors, because it is a tool that is actually used by perpetrators when it comes to survivors. So imagine you're a survivor, and usually maybe you get some time out by going to work, by going to school, meeting other people, so you're socializing, and then comes this pandemic, catches everyone by surprise, and we're all being required to stay at home. So you are staying home, but are you safe at home? Because maybe now you're stuck with your perpetrator. Because I think in the peak of the lockdown, some people did not want to be alone. So for some, that meant probably going to stay in the same house where your perpetrator is staying. Maybe it was an uncle and you're stuck with that person with little or rather restricted movement. So we're receiving a lot of calls, a lot of cry for help, and some were saying, you can only call me at this time because I'm not able to take calls. If the perpetrator is probably the husband, then call me when he's gone to the shops. He usually goes for a walk at this time. So it was very difficult to maneuver, but we started also realizing a high number of survivors coming into the clinic after the restrictions started easing down. So some of these rapes, unfortunately, they were happening during the lockdown and surpassed the emergency treatment period of 72 hours, but still we managed to give them some sort of counseling and psychotherapy for those that are heavily traumatized.
As we are winding up our program, thank you very much, ladies, for coming. What is your parting shot as we close our program? Let me start with you, Danai.
Pazvaitikira taura pazvaitikira.
Okay.
Report.
Then Florida.
I will emphasize on what Danai said. Taurai, don't keep quiet. Silence will not protect you. Isusu hatisima trained professionals to be able to cater or rather monitor the sexual violence. Because years later, we are not trained professionally to deal with this. And always reach out. We've got lines that are open for you. Our toll-free line is accessible. I will say the number now. It's 080-08-472 080-08-472. So we are also available on WhatsApp on 0775-672-770 0775-672-770. And you can also find us on all social media platforms at Adult Rape Clinic, and our website is www.adultrapeclinic.org.zw.
Thank you very much. That's Florida Mapeto from the Adult Rape Clinic and Danai Chirau from Zimbabwe Women Lawyers Association, where we were discussing sexual and gender-based violence. But Zimbabwe, remember, coronavirus is still with us, so please practice social distance, wear face mask. Goodbye for now. Enjoy our programming on ZFM Stereo, my station, your station.
We are the People Station.
Let's go.
All the hits.